Yeah, so welcome everyone. I think this is the 25th version of our Global Medical Physics Education Lecture Series. So a while ago, we used to ask what topics people would like us to present on, and one of the topics that a lot of people recommended that we present on is anatomy, which is quite tough to cover in a single lecture. But we found someone brave enough to attempt that. So yeah, Dr. Eman Suliman is a practicing physician in the Sudan. She is very knowledgeable on sort of all things anatomical, and she also has done a lot of research in medical physics, so that she kind of is familiar with our field as well, and hopefully we'll be able to give an anatomy lecture that's appropriate for medical physicists, specifically focusing on radiographic anatomy and sort of the level of detail that is appropriate for us as physicists to know. So let me turn it over to Dr. Suleiman, and yeah, go ahead, Iman.
Thank you so much, Dr. Joe. Um, uh, Today I will be presenting to you the anatomy lecture. Um, yeah, I'll start by giving an anatomy lecture, particularly concerning the CT and MRI and how the different body parts are represented in CT and MRI. Okay, let's start. Okay, so as we all know, the medical imaging, particularly the MRI and CT, plays a huge role in healthcare by providing a detailed imaging of the body, different parts, to enable physicians to reach an accurate diagnosis and treatment. This is a CT scanner, and this one is an MRI scanner, as we all know. Okay, a quick overview of MRI and MRI provides detailed image of internal structures, particularly the soft tissue. It's better at showing soft tissue like brain, spinal cord, and musculoskeletal system and vascular structure, whereas CT, it's better at showing bony structures. Okay, let's start with anatomy of the brain. Roughly, the brain formed of the right and the left hemisphere, the cerebellum, and the brainstem. And we show the brain in different planes during the imaging, or when we image the brain, we have different planes. Those planes are frontal or coronal. It's here. So the frontal or the coronal is when we like take an imaging or like just cutting the brain and look at it from the front. Thus it's called frontal. And here the sagittal plane is when like we cut the brain and we look at it from the medial side. And we have the transverse or the horizontal plane. It's when you put the brain and you look at it from above or below. It depends. Um, and here we have different directional terms and body planes. So when we say the word anterior or ventral, it means like in front of, like a body organ that is in front of like other body or in relation with other body organ. And when we say the term posterior or dorsal, it means in the behind. And the term proximal, it's term used in relation to the trunk. The word proximal or distal. Proximal means closer or toward the trunk, and the distal is away or further from the trunk. Let's take like the upper limb. as an example, we would say the elbow is proximal and the wrist, for example, is distal, furthest away from the trunk. And we have the term median. Median means the midline, like if the structure is or the organ is situated in the exactly the midline of the body, uh, we give it the description of median. And medial is every other structure that's laying toward the median or the midline of the body. And lateral is away or any structure that's away from the midline of the body. And lastly, we have the two terms, superior or cranial, it's like toward the top of the head, and inferior or caudal means toward the feet. And we have in the brain anatomy, we have different lobes of the brain. We have the frontal, and posterior to it is the parietal. And then at the very back, we have the occipital, and here laterally, we have the temporal lobe. And of course, this is the cerebellum, and this is the spinal cord. Okay, so this is lobes or regions of the brain from a sagittal view. So we cut the brain into half, and now we're looking at it from the medial side. This is the frontal lobe here shown in red. This is the anterior or the front, and this is the posterior. So um, this lobe here, the red one, is the frontal lobe. And here, this is the parietal, this is the occipital, and this is the temporal. Now here we have like a new loop that could be seen on this view. Um, it's called the limbic loop. It can only be seen in this view, like the sagittal view. Okay, we have structures that we could see other than the brain lobes from the sagittal view. We have the this structure here, a very big structure. It's called the corpus callosum, and then here the thalamus, and here is the hypothalamus connecting to the pituitary gland through a pituitary stalk, and here a very important structure called the optic chiasm, and this is the optic nerve. The reason the optic chiasm is so important because whenever there is a pathology in the pituitary gland, if there is a tumor, it will grow and compress the optic nerve, and the patient's vision will get affected. Okay, let's try to name those parts we just learned on this MRI sagittal view. Here are the brain lobes, as we can see. Here the frontal lobe, in here the parietal, and here the occipital lobe. Yeah, this here, and this is the limbic, of course. And here these structures. This is the corpus callosum here, and here the the thalamus. This is the thalamus, and here the hypothalamus, and this is the pituitary gland, and here the pineal body. Here is the brainstem. We could see the three parts forming the brainstem, the midbrain, the bones, and the medulla oblongata. And it continues as the spinal cord. And of course, this is the cerebellum. Okay, we have other terms that are sulci and gyri, and I think those two things give the brain its characteristic folded appearance. The sulcus is a shallow depression or groove in the cerebral cortex. So these are the sulcus, those shallow grooves. And we have two main sulci. The central one, it's here between the frontal lobe and the parietal lobe. And between the frontal lobe and the parietal lobe, we have the central sulcus, and here between the the temporal and the frontal lobe. We have here, this is the lateral sulcus. And we have the gyrus. What's the gyrus? The gyrus is it's a ridge on the surface of the cortex. So those ridges are called gyrus. So together, the sulci and the gyri, they give the characteristic folded appearance of the brain. And we have two main ones. There are many, but the two main ones are the precentral, here the red one, and the postcentral gyrus. And the precentral gyrus is concerned with the motor function of the body, and the postcentral is mainly for the sensory, somatosensory. It's a somatosensory area. Okay, so this is an example of brain tumor. As you can see here on the sagittal view, it's compressing the brain cortex, the structures. Here we can see the corpus callosum is compressed, and here on the coronal view as well. Okay, this is a coronal view of the brain. As you can see, this on this side, it's an autopsy. It shows the brain, the brain. Sorry, this slides keep changing. It shows the gray matter and the white matter, and here the ventricles. The gray matter is formed of the axons of the neurons, and the white axon is formed of the bodies of the neuron. Neurons are the cells that forming the central and peripheral nervous system. And here's the ventricles is where the cerebrospinal fluid is formed, and it circulates in the brain and the spinal cord through a specific pathway. When I get into detail. Yeah, and here is the picture for showing the gray and the white matter and the ventricles, and here the corpus callosum. And this view, it shows like a very small part of it. Okay, this is an MRI of a brain tumor on a coronal views. Let's see this tumor on the parietal loop, compressing the midline. See, this is the midline, and I think it's shifting the midline towards the other side, and the ventricle is compressed. Okay, this is a transverse view of the brain at different levels here, like from the bottom up. At this level, it shows the cerebellum and the brainstem. And here it goes higher, and the cerebral hemisphere starts showing. And here the part of the brainstem was the medulla, and here is the midbrain. And here is showing the ventricles, and the ventricles are clearly shown at this level. Okay. Okay, so what are the values of CT over MRI? As we all know that CT are generally faster than MRIs, which is important in emergency situation, and also CT scanners are widely available than MRI scanners, making them like accessible. And also the CT scanners are better at showing bony structures. So they're faster in showing bone pathologies and fractures. And the CT scanners are generally safer for patients with certain metal implants, like a pacemaker, that may not be compatible with MRI. Okay, here is CT of the brain. As we just said, the CT it's better at showing the bony structures. As we can see here, like there is no much can be seen in the brain. It doesn't show the sulci or the gyri. It's not that detailed. So the CT is better at showing the bone structures. Okay, so let's go and talk about the anatomy of the spinal cord and the vertebrae. Okay, so the vertebral column or the backbone or the spine is um, is formed of the vertebrae and the spinal cord. The vertebrae are mainly five groups. We have the cervical vertebrae, numbered from C1 to C7, and the thoracic vertebrae numbered from T1 to T12, and some textbook are called D1 to D12, and also the lumbar vertebrae. Uh, there are five numbered from L1 to L5, and sacral vertebrae are five fused sacral vertebrae, and finally the coccygeal vertebrae are four and fused. So in total there are 33. There's 33 vertebrae. The first 24 ones are articulated and separated by intervertebral disc. And the main function of the vertebral column is giving the body its structure and protecting the spinal cord from injuries. Yeah, here the normal CT of the CT here the CT of the cervical vertebrae. It's showing the bony structure better, and as we can see here, the MRI it's better at visualizing soft tissue. Here we can see the spinal cord and sorry, the spinal cord and the vertebral disc. Yes, and here we have cervical spine fracture in CT. As we can see, there is a fracture in C6 and C5, C6, and C7 vertebrae. And here we have cervical disc herniation on an MRI. It's C5 disc herniation, C5, C6 disc herniation. It's seen here. Yeah, and here we have normal thoracic vertebrae. There are 12 in number. In CT, we could see the bony structures, and in the MRI, we could see the soft tissue, the intervertebral disc, and the spinal cord. Yes, and here we have a normal lumbar vertebrae. It's slightly curved. It has this natural curve here. This is the lumbar vertebra in CT, and here is on the MRI. Yes, and here we have L1 fracture on the CT. The first lumbar vertebrae fracture. The body of the vertebrae here is fractured and segmented into many parts. And here we have L5 cord compression, herniated and just get compressed. Yes, and here are the sacral and the coccygeal, the tailbone, shown here on CT and on this side on an MRI. Okay, now let's move on to talk about head and neck anatomy. Yes, this is a sagittal view of the oropharyngeal and nasopharyngeal parts. Here is the hard palate, and at the end we continues as a soft palate, and we have the tongue in here, and here's lips, and this part is the nasopharynx, and this part is the oropharynx, and the whole of this part is the pharynx, and then at the end it separates into two. Here we have it continues as the respiratory part, the trachea, the windpipe, and at the very back it continues as a digestive system. The first part is the esophagus. Yes, and here we have the salivary glands. They are paired in each side. There are three pairs in each side. This is the parotid gland right in front of the ear, and here next to the mandible, we have the submandibular gland, and beneath the tongue we have this is the submandibular, and here beneath the tongue we have the sublingual gland. Yes, and here it's the glands again. The parotid gland is here in front of the neck, and the duct of the salivary gland is open in the upper second molar tooth. It secretes saliva. It helps in digestion. And here we have the submandibular gland, and its duct open at the floor of the mouth. Yes, and here we have a transverse view of the parotid gland. Yeah, the parotid gland are here and on this graph. It's yellow in color, and inside the parotid gland, a very important structure, we have the facial nerve inside the parotid gland. So, and here how it looks in a transverse view on MRI. Okay, and here is the submandibular gland stone. As you can see here, this is a CT. So it appears here as a white structure. That's a stone in the submandibular gland. Okay, let's talk about the anatomy of the breast. Yeah, so the breast is a glandular structure formed mainly of an adipose tissue or fat, and we have lobules and lobes and lobules, and we have the duct system that converge into main ducts, and then it opens in the nipple, and the nipple is surrounded by the areola. As we can see, the breast here is attached to the pectoral muscles, and the pectoral muscles is attached to the chest wall muscles. And whenever there is any pathology or any tumor in the breast, so it could invade the chest wall, as we will see in a minute. Yes, this is a mammogram of the breast. It shows the normal breast tissue. Here is the fats, and here are the lobes and lobules and the fibrous tissue, and here are the ducts converging into the nipple. Yes, as I just mentioned, that if there is any pathology or tumor in the breast, it could invade uh, the the chest wall muscles here. It invaded the chest wall muscle. This is a CT of the breast. Yeah, and here is the breast tumor. Okay, let's move on to talk about the anatomy of the thorax. Here is the thorax. The thorax is formed of sorry. The thorax is formed of the rib cage, and then the heart and the lung and the vascular structures inside. So here is the heart at the center, and slightly to the left side. It forms of the right and left ventricles. Oh, sorry. right and left ventricles, and then we have right and left atrius and the aortas and the pulmonary trunk. This is the aorta, this is the pulmonary trunk, and here the superior and inferior vena cava, returning back to the right atrium. Here on the CT, you can see the heart. This is the biggest structure here is the pulmonary trunk, and here the aorta at like a very different section. It's showing the descending the aortic arch. Okay, so this is the CT scan from the neck. We'll go from the neck and downward. Here we could see the trachea and the thyroid gland on the neck. And now we'll move down. The trachea, this is like the vascular structure studies to shown. This is the left subclavian and the right subclavian and the common aortic. We're mainly concerned with the trachea at this level. Here is the trachea, and at the very back is the esophagus. Yes, at this level, the trachea has bifurcated into two main bronchi. At this level, I would say this is the level of T4, or it's called the carina. It bifurcates into two parts, the left main stem and the right main stem. And by the way, this is the left side, and this is the right side. Is there any question? Okay. Yeah, now we're moving down. The heart start to show. Here we have the ascending aorta, and this is the descending aorta, and the aortic at this level is not shown. Here are the lungs, the left side of the lung, and this is the right side of the lung. It's shown in black. Okay, and here the esophagus is shown. It's right in front of the aorta. So this is the vertebrae, and this is the aorta, and in front of it is the esophagus. Okay, now here is the lung lobes are shown. Okay, let's move into the anatomy of the abdomen. Here, the digestive system, it starts from the tongue, and then we have the oral cavity, the pharynx here, and in the pharynx, it divided into two, the trachea, and that's concerned the respiratory system, and at the very back, we have the esophagus that continues inside the thorax, and then to the abdomen as a stomach, and then we have the small bowel, and we have three parts of the small bowel: the duodenum, the jejunum, and finally the ileum. And then we have the cecum, the very first part of the large bowel, and we have the appendix attached to the cecum, and then it continues as the ascending colon, and then we have the transverse as it transverse the abdomen, a transverse colon, and then we have the descending colon and the sigmoid colon, and here we have the rectum, the anal canal, and finally the anus. And here we have those flexures, the two flexures on the right and the left. This flexure is called the hepatic flexure, as the term hepatic means the liver, so it's close to the liver, so it's called the hepatic flexure. And on this side, it's called the splenic flexure. The spleen lays here on the left side. Yeah, and here is the liver and the bile, gallbladder, and the bile ducts. And here we have the spleen. It opens on the second part of the duodenum. Yes, and this is transverse view of the abdomen. This is the right side, and this is the left side. And on the right side, we have the liver. And on the left side here, we have the stomach. And this level, this is the level of first lumbar vertebrae because we can see the pancreas, and the pancreas has the head, neck, and the tail. And here is the abdominal aorta, the inferior vena cava. These slides keep changing. Yeah, here is the inferior vena cava, the aorta, and the right and left kidneys. And this structure here on the very left is the spleen. Okay, this is a coronal view on a CT, coronal view of the abdomen and a CT. On the right side here, we have the liver, and this is the portal vein that goes inside the liver and then continues as an inferior vena cava, and then goes into the right side of the heart. And here we have the inferior vena cava and the aorta. Here we have the stomach. Here is the ascending colon, as we said, and this is the hepatic flexure. And on this right, on the left side, we have the splenic flexure and the descending colon. Yeah, and here the aorta bifurcates at the level of L4 into right and left common iliac arteries. Okay, this is a sagittal view of the abdomen. So we cut it into like two equal halves, and now we're looking at it from the medial side. Here is the liver, and here is the pancreas. It lays like at the very back of the abdomen. That's why pancreatic cancers are discovered late, or any. Yes, pancreatic cancers are discovered late. And in the front here, we have the stomach. Here we have the transverse colon. Here we have the parts of the small bowel. We have the duodenum, duodenal loops, and the ileum. Here we have the third part of the duodenum. This is a clearly CT of a female patient. Thus, the uterus and the bladder are shown here at the pelvis. Okay. Here we mainly trying to show the pancreas on a CT. So the pancreas is here between the liver and the stomach, and and here on the transverse view, it's shown here behind the between the liver and the stomach. Okay, so on this CT, we will try to go from up to down in the abdomen. So at this level, we could see the liver, the stomach, and the spleen. So I believe this level is T12 level, because the kidneys are not shown are not yet shown, and they start at the level of L1. The left kidney now is shown. This is L1 level. We could see the liver, the inferior vena cava, the aorta on the left side, the stomach, the spleen, and the left kidney. And the left kidney is slightly higher than the right kidney, since the right kidney is compressed by the liver. Yes, and at this level, it's L2, L3 level. We could see the right kidney, left kidney, and the pancreas is shown here, and the gallbladder. Now we're moving down, a bit down. Here the lobes of a small bowel could be seen. Here the small bowel and the renal veins. Now we're going down. Here the pylorus of the stomach, the small bowel, and here is the ascending colon on the left side, and the descending colon, I mean, on the left side. The ascending colon cannot be seen because of the liver. Here is a bit lower, so now the ascending colon can be seen, and this is the descending colon. The transverse colon is here, and see the liver is getting smaller and smaller, and the spleen has disappeared. Let me go back so that we see the difference. Yeah, see at this liver, notice the change on the liver and the spleen. So the liver and the spleen are big. Now we're going down. It's getting smaller and smaller. And now the spleen is disappeared, and the liver is getting smaller. Yes, and at this level, we could only see the bowel, the large bowel, and the small bowel lobes. Yes, still we can see the bowels, and here we start seeing the common iliac veins and arteries. So this level is below L4. Yes, at this level here we could see the cecum and the terminal ileum. These are cecum is the first part of the lower bowel. Yes, here we can still see the transverse colon, the cecum, and the lobes of the small bowel. Yes, yes. Here the descending colon is ending, and on this level we start seeing the sigmoid colon, and that's the very end of the abdomen. Here start seeing the rectum. Now we're entering the pelvis. Yes. So this is the pelvis. That's the very end of the abdomen. Here is the rectum, and at this level we can see the bladder and the uterus. Okay, let's move on to talk about the anatomy of the pelvis. So the pelvis mainly formed of bony structures and pelvic organs. The bony structures are the ilium, cecum, pubis, sacrum, and coccygeal. And with many concerned with the organs, we have the reproductive organs, the urinary bladder, and the rectum. This is the bony structures, roughly. Yes, so this is the female pelvic organs. Here we could see the bladder. This is the front, and that's the back. Here we could see the bladder at the very front, and here is the urethra, and then it goes into the external genitalia. And here we have the uterus. The uterus is slightly like curved over the bladder. And here we have the cervix, and then continues as a vagina. Yeah, and then the external genitalia. And at the very back, we have the rectum and the anal canal and the anus. Is here on CT. Here is the bladder. This structure is the bladder, and then the uterus is curving over the bladder. And here we have the cervix. It continues cervix continues as the vagina, and here we have the yeah, this level we cannot see the rectum. Okay. Yes, and here we see the cervix. Here is this is the uterus, and then there is a cervical tumor. As you can see, it's very big. It starts compressing the rectum posteriorly, and the bladder anteriorly, and it's pushing down the vagina. And the cervical cancer is quite common here in Africa. It's affecting female of middle age. between 30 and 40, and it's preventable. Like it could literally be prevented by just giving the HPV vaccine. That's why I mention it here. And here we have a transverse view of the female pelvis. Here we have the bladder, and here it always goes like this: bladder, uterus, and rectum. So the bladder in the front, the uterus here, and at the very back we have the rectum. Yes, and now this is the male pelvic organs. The arrangement is a little bit different. Like it's the urinary bladder, and then at the neck of the urinary bladder we have the prostate gland, and at the back we have the rectum. So it goes like urinary bladder at the neck or down. Here we have the prostate, and then at the back we have the rectum. Here on CT, this is the urinary bladder. At the neck of the urinary bladder, we have the prostate gland, and then we have the urethra, of course, going through the prostate gland, and then continues to the penis, and then to the external genitalia. And at the back, we have the rectum. So if there's any tumor in the prostate, it will push back and then affect the rectum. Okay, here we have CT of the male pelvic organs. Here we have the urinary bladder, and here's the prostate. Here in a coronal view, and then this side is the sagittal view. Here is the bladder, and at the neck we have the prostate gland. Okay, this is a transverse view of a male pelvic organs. Here we have the bladder at the very front, and here at the back. At this level, it's only showing the seminal vesicles, and here is the rectum. This is a higher view of the male pelvic organ, and now here is a lower view. The prostate gland starts showing. We cannot see the bladder at this level because like the prostate located at the neck of the bladder, and here at the back we can see the rectum. Yes, and here is the example of a prostate cancer. It's very big that starts compressing the bladder anteriorly and the rectum posteriorly. Yes, thank you so much for your time, everyone. I hope that was helpful.